Welcome to the Senior Rehab Podcast,
the podcast for rehab clinicians that want to better serve older adults.
And now, your host, Dustin Jones.
Hello, friends, and welcome to the Senior Rehab Podcast. Today's Senior Rehab short comes from previous Senior Rehab Podcast guest, Lisa Maczura. She wrote a guest post at strivelabs.com titled, How to Build a Relationship with Your Physical Therapy Patient. This is Ann Wendell starting off the post. Those of you who are active on Twitter need no introduction to Lisa Maczura. She is the sassy, well-spoken, thought-provoking instigator behind the account at Lisa Mac and Cheese. Lisa is an adult with cerebral palsy who reminds all of us that we need to partner with our patients in order to build lifelong relationships. I had the pleasure of meeting Lisa at CSM 2016 in Anaheim, where she shared her story as part of a patient panel through the section on women's health. This week, we hand our Tuesday tip over to Lisa, who has laid out some guidelines from the patient's perspective on how best to develop strong relationships with new patients. Thanks, Lisa. How to build a relationship with your physical therapy patient. Be polite and don't neglect formalities. Introduce yourself by your full name. You are not a waiter. You are, in a sense, auditioning. Be friendly. Ask your patient what they prefer to be called. Let them interview you a little. You are going to have to learn to move and talk at the same time. When you do an initial evaluation, explain in brief layman's terms what you're looking for as you do it. Let the patient's questions be your guide. If the patient is quiet, then you should verbalize what you are doing anyway. Make it simple, not scary. Keep intra-office gossip to a minimum when working with a new or newer patient. If the patient has worked with a physical therapist before, ask how that went. Pay particular attention to effect, not just facts. Stay calm. You can wonder aloud online with other physical therapists if you want, but it is essential to stay calm with the patient. Expect pushback at times. This often has less to do with your skills and charm than with the patient's fears. Try to root out fears with consistent verbalized support. Don't forget to share bits of your real life with your patient, as they will need to share their real life with you too. Reciprocity builds trust. The rules for physical therapists who take care of chronic versus acute patients are the same. If you have a short time frame based on allowed number of visits, acknowledge that openly to the patient and ask for their help in getting the most done in a short space of time. Create a partnership with your patient. When working with chronic patients, don't take them for granted or assume that their physical circumstances will not change. And lastly, remember, relationships take time. Thanks, Lisa. Hit me. I want to thank you for listening to this podcast. The show notes and much, much more can be found at seniorrehabproject.com. I want to encourage you to go there so you can join me and many others in the movement that's changing the face of geriatric rehab. Just go to seniorrehabproject.com, click join, and you'll be able to get access to our private Facebook group, which can basically serve as your virtual mastermind group. You'll get a short and sweet monthly email from me with useful links for you and your patients. And lastly, you'll get 10% off your first purchase from the Senior Rehab store. So all of this can be found at seniorrehabproject.com. And until next time, my friends, do not forget to stay funky.